This has been Spain's deadliest day on record since this outbreak began, and the situation there gets more grim as each day goes by. Health authorities had been buoyed by some of the data showing that at least new infections appeared to be going down somewhat in Spain, but obviously still hundreds of people dying each day after contracting this coronavirus. Now, Spain's government says it's ordered millions of dollars worth of extra supplies. Its hospital system has been inundated. In fact, it's on the brink of collapse there following the massive influx of people coming into the hospital system with this disease and, of course, with other health issues as well. It's now going to try to increase the rate of testing. It's been testing about 20,000 people each day. It wants up to 50,000 Spaniards tested each day going forward. And Madrid continues to be the worst hit city. 3,000 deaths there and more than 27,000 infections. In Italy, we're also seeing the death rate continue to be so high each day. More than 800 people there died in a single day yesterday. Doctors there are also warning the government, don't lift these lockdown measures that have been in place for a month now in Italy. The government has said they'll be in place until at least the Easter holidays in a fortnight. But doctors' associations in the northern region, the epicentre of that epidemic, have said that if measures are lifted too soon, they'll start to see that rate of infection continue to climb.
Now, Bridget, on that point of test kits, there are reports that doctors in the UK are frustrated by the lack of availability of these tests.
Well, that's right, Kirsten, and this has really been an issue in the UK for weeks. When I was there, I was speaking to the Doctors Association, which represents hundreds of doctors all across England, Scotland and Wales who are working in the NHS as more and more coronavirus patients come into the hospital system. Their concern is that they themselves can't get tested. So if they're showing some symptoms, if they have a fever, a sore throat, things like that, they're staying at home when they'd really rather be at work, but they can't know whether or not they've contracted the disease because tests have been too slow. Today, the government conceded that there aren't enough tests. It's working very hard to try and get more tests out into the community. Its response has been a bit slower than places like Italy and France and Spain that have had a higher rate of death and infections so far. But the UK also recorded more than 300 deaths in a day, and that was its worst toll so far.
It's also being reported that children have now died in Europe after contracting COVID-19.
Yes, tragically we heard a 13-year-old boy in London died yesterday. He'd been taken to hospital just a couple of days beforehand to King's College Hospital. He was from Brixton, just 13 years old. He'd been struggling to breathe when his family took him to hospital. He was then placed on a ventilator and then went into an induced coma. His family put out a statement saying they're beyond devastated. They didn't know of any underlying health conditions. They've said this is a warning to other families about how important it is to heed these measures and to understand why these lockdowns are in place. And in Belgium, a 12-year-old girl also died. She'd also tested positive for COVID-19. The government wouldn't say whether or not she had any underlying health conditions, but it is a reminder that, of course, we know older people and those with underlying health conditions are at serious risk of this disease, but no age group is immune to this deadly outbreak.
It is indeed. Bridget Brennan, thank you.